Good afternoon and welcome to the final episode of Sense with Science. Coming to the end of something is always bittersweet, especially when the journey was as good as it has been with Tansri Dr. Jamila Mahmood, now newly Executive Director of Sunway Center for Planetary Health and Infectious Diseases Specialist, Professor Dr. Adiba Kamarul Zaman of University Malaya, and member of the World Health Organization's Science Council. So it's been 7 months, and we have finally come to the 20th and final episode of Sense with Science, a project that was birthed like many of Dr. Jamila's aspirations out of the blue and in response to the very real need for on-the-ground, real information and science-backed education. And we end as we begin with just Dr. Jamila and Professor Adiba, a tag team akin to me, to Phil Knight and Bill Bowerman of Nike, two visionaries who saw the need and went ahead and just did it. With, of course, the gracious support of Pusat Perubahan Naluri and broadcast assistance of Astro Awani. So while the series ends, the pandemic has not. There is great rejoicing today that we have finally been able to open state borders. Beginning tomorrow, our new Prime Minister has announced that interstate travel is now allowable. So today's curtain closer will address how we live with COVID-19 in the long run. Over to you in Europe, Dr. Jim.
Assalamualaikum. Good afternoon, everyone. Hello from Geneva, Switzerland, where I'm doing a little bit of work. Karen, what a day. It's our 20th episode. It's a day that Malaysia allows interstate travel. It's a day we're addressing, how we're going to coexist with COVID-19. And for me right now, at a personal level, being in Europe, life is almost back to normal, even though there are quite a lot of cases still every day. In Switzerland here, I don't need to wear a mask when I'm outside, but I'm Malaysian, I still wear a mask. And indoor dining, you need to have your COVID certificate. And the restaurant itself scans you, not you scan in. So they take these things very, very seriously. On public transport, people are masked. There's no drama. People just get on with it, right? At the same time, just to share that, the cases are in the thousands here. The testing centers are everywhere. People here have access to home tests. And if you're traveling, you can pop by the airport. There's a little place there you can do your PCR and get your result and leave. And by the way, Adiba, they do saliva PCR here. So it really gave me a real life experience of how people are living with the pandemic and, getting on with life. So as I reflect back on the last 20 episodes, I'm so grateful that, Adiba came on board and you, Karen, helping us steer through. And of course, two people who we don't see on the screen, my Sarah and Kadi, as well as Amanda, who helped us, and I had the pleasure of meeting Amanda in Sabah. What are the highlights for me? I think we set out to demystify the science. And I think that, we've had some very personal feedback. I want to thank people who have watched the show and met me at the vaccination centers. I think for me, undoubtedly, and particularly because I'm an OBGYN by training, the episode we had with Imelda on pregnancy and COVID really was the lever that really allowed me to push very, very hard as part of the vaccination team to have a special, pregnancy weekend vaccination session where we had 3,000 pregnant women coming per day at MyTech, and then at Sunway Pyramid as well. And thank you for those who've had their babies and sent photos to us. So, this has been really amazing. And, it's good to see that, women are now getting their vaccinations, when they're pregnant. Having said that, we've also seen some tragedies where women have not taken their vaccines and succumbed to the disease, and some of them who I know. So, our job is not done. Even without the program, I think each and every one of us now has to continue, including the viewers, to remind their families that it's not just the vaccination. We still have to be very careful about things like ventilation, which is one of the best sessions we had as well with Serena Hijaz, and so many things. Adiba and I have been through a roller coaster of I think that's the only way to describe it of ups and downs, but I think it was friendship and camaraderie that saw us through this, and we were both very much involved with the Greater Klang Valley task force, and trying to bring the numbers down and all that. And I think in retrospect, there's no doubt that knowledge, behavioral change, but more importantly, collaboration and the willingness to be humble and listen and learn from each other, that is going to help us get through this. And I think this has to continue. We will have to live with this for a while. We may be looking at, annual boosters if this is endemic, but, we're getting there. We're getting there, Karen. Thank you very much.
Adiba.
Yeah, I think roller coaster is one way to describe what we've been through, particularly in 2021. I think as bad as we thought 2020 was, that was just a dress rehearsal, right? 2021 saw us really got the full onslaught, particularly between June and September, onslaught of the Delta, and and all. We won't go into all the gory details, but it's left many of us sort of traumatized, burnt out, all the other description. But kudos to everyone. I think we pull through. It's so fulfilling to go to the wards now, to see that the number, every day we're closing down wards, COVID wards, obviously not just in my hospital, but all the other hospitals as well. Because it's also now time, in addition to continuing to live with the virus and making sure that we don't have too many spikes and surges that we can't cope, it's also time to start looking after all the other non-COVID patients who've had to take a step back to make way for COVID patients. So I think it's not exaggerating to say that each and every person, each and every Malaysian has been touched in one way or the other, or knows someone who's who is either struggling with long COVID or who passed away from COVID. So we don't want that to repeat. I mean, we ought to be proud of the vaccine coverage that we have achieved. But every time we think we're, and I'm usually a very, very optimistic person, but somehow with COVID, every time that we think we're ahead of it, it does something else, So right now we're in the midst of assisting Ministry of Health and the National Recovery Council in making sure that we have things in place to live in an endemic state. You've heard the ministers talk about simplifying the SOPs. Yang Maha PM has just announced reopening, but with that also comes community responsibility. I think, we just can't leave everything to the government to police us. I think surely by now everybody should know what is how to prevent from getting infected, because even if you've had the best 2 doses of whatever vaccine you had, there is that small chance of getting infected, and even if you don't get very severe symptoms yourself, there is still a small risk of transmitting to someone who may, even if vaccinated, get, symptomatic disease. So last Friday, I was in the wards doing rounds, and there are still people coming in with what we call breakthrough infections. Very, very small, but it just reminds us that we can't let our guards down. So we've got the tightening or simplifying the SOPs to live with the new normal, if you like. We're working on the alert levels so that we can relax the restrictions and tighten if ever the numbers go up again. I just came from discussion, that's why I was late, with some people from Ministry of Health, and a few further discussion on the national testing strategy. We need to also make sure that all that's in place. So lots of things happening. Even though the numbers have come down, we can't relax. We can't completely relax. We can't let our guards down. But it was nice this afternoon to go out to lunch and and not feel like things are still the way they were. So cautious optimism. Yeah. And being sensible, really being sensible. So like Tan Sri was saying, in Switzerland, when you're out and about, no mask, but when you're in public transport, when you're indoors, especially fully ventilated, no harm in keeping that mask on.
Adiba, one of the things that have come up during our time of absence online with the series is your appointment to the National Recovery Council. And may I say that there were so many people who were delighted at you being named to the council. I know you are probably like, alamak, mak kerja lagi. The fact that there are so many people who have come to know you through this show and who come to look at you and Dr. Jim as our beacons of good medical sense. We were very, very happy to have you named to it. So congratulations on that. Can you tell me if the work of the National Recovery Council is proceeding as well as you want to, or are there more hurdles to jump through?
Well, I think obviously there were some hiccups when there was political instability. So hopefully moving forward, there's going to be more stability and more focus on how to open up safely and live with the virus and revive the economy, etc. So we had a meeting a couple of weeks ago, and we're going to have another one this Friday, I think. And I think we, part of that work that I was describing in terms of working with MOH on a national testing strategy is part and parcel of the NRC work. And there's going to be some discussions. I think Dr. Tini, who's also on the council, around looking after the marginalized, particularly the B40 population. So the good thing about the National Recovery Council is not just about health. Obviously, health is important, but there is also much discussion on how to open up safely, to allow the economy to open up again, whilst making sure that we don't lose control of the pandemic. Yeah.
Okay. Speaking of your ward rounds and how COVID wards are closing down, are we seeing, when you see patients, are there very marked cases of Delta versus some other variant, or?
Oh, it's been all Delta since July.
Okay.
We just saw our lab at PPM just released some results for September. or from the last one, which was August to October, and it's all Delta.
Right. But the good news is that all the vaccines that our countrymen have received they are working against Delta. They are protecting our citizens against Delta. Is that not right, Dr. Jim?
Yeah. Go on. Yeah.
Sorry.
There's always going to be breakthrough infections, but yes, it's done a tremendous job.
Yeah, I think without a doubt, I mean, the nature of pandemics and viruses is that they will continually evolve and mutate. And when the incidence of disease is high, then the mutation becomes even more aggressive, right? When there's much more viral load to mutate, so to speak. But I think, the vaccinations do work. They do work to prevent severe disease. And we should, you know how it is like when you're in Malaysia and everything is not good. Every Malaysian is pessimistic. Not every Malaysian, but many Malaysians. We live in an environment of a lot of mistrust, and this is why it's been very difficult to get the the behavior change we want, so to speak. We have a very small group of vaccine hesitant population who are loud, and the ivermectin, hullabaloo that went on. But when I came here, and started talking about what we have done, because I've been working on the vaccine, task force from the start, right? And in the negotiations and about procurement, I mean, really helping and supporting, YBKJ and the Minister of Health, previous Minister of Health as well. And of course, the Prime Minister, Tan Sri Muhyiddin, who really, I mean, credit where credit is due, he really pushed very hard for us to get onto COVAX, procure as early as possible, and so on and so forth. So when I tell people here in Europe that we have 90% of our adult population vaccinated, and soon, with the adolescent vaccinations, and maybe later in future children vaccinations, we are really doing very, very well. And this has been because not only the leadership, in the vaccine task force, but also the private sector coming on board, the university hospitals, volunteers, and the public really coming together, And for me, the whole vaccination program, in my opinion, because I was very close to it and, vaccinating people at the centers as well as, in remote places, traveling around the country. It was for me, for the longest time, that one time I felt the country was coming together for a common cause. And it was so moving for me to see, people from all walks of life, coming together, right? And the fact that we thought through about, creating calm rooms where, children with neurological disorders or, older people and all that could actually have a calm room to vaccinate. I mean, to that detail, right, in the madness of the PPVs, for me, it was one of the instances where I felt there was a bit of a nation building element. And I think that's why the vaccination program is very special to me, not just because of the numbers, but because of the sheer cohesion that happened when people were going to get their vaccines. So here in Switzerland, only about 60% are vaccinated. So, people are asking me what happened in Malaysia, what was the secret and all that. So I think one is that, we don't have this attitude that, this is all about my right? But I think our attitude is that, the whole lindung diri, lindung semua phrase, it may be catchy or some may even call it corny, but it's true. You're not safe till everyone is safe. And I think, reaching out to the most vulnerable, the migrants, the refugees, the poor, and those who we don't see most of the time, is going to be critical. So, we have to keep pushing on. I think that we owe it to each other to protect each other. So that goes beyond the vaccination as well, as Adiba mentioned. And, and I think the Sense with Science, without a doubt, I think was one of the first public facing shows that really pushed for ventilation very early on. And I think that now, Adiba and I laugh and smile, and, we send emojis to each other when we see on social media the ones who didn't help us push the ventilation issue forward, now championing ventilation. So, it took time, but we did manage to push this through, and we must continue to push it through. So just to share with you, here in Switzerland, if you are dining outside the restaurant al fresco, they don't bother to check your COVID certificate. But the minute you go indoors, they check your COVID certificate. So, which means that for early on, they've already accepted the fact that ventilation is key, right? That outdoors is safer than indoors. And we've been repeating this over and over again. Every meeting, every show is 18 times higher risk indoor than outdoors. So we can say it in our sleep now, but so these practical things for the viewers out there, if you're at home, make sure your windows are open. If you can have meals, if you have friends over, try to do it as much outdoors as possible. No doubt people may be already fully vaccinated, but there's still that risk of infection. And because almost everyone is already been vaccinated, of course, the breakthrough infection will be high among vaccinated people. That's a given.
Well, just coming back to the topic of vaccinations and our mass vaccinations, I think, Dr. Jim, you were very, very instrumental to the changing of mind to many people who had actually opted not to vaccinate. I know that on the show, we've received so many reach outs saying that, I was not going to get vaccinated, but after listening to you, to Dr. Jamila and Professor Adiba, I felt compelled to change my mind. And we did it without fear. We did it without the sort of a threat, to different things. So I think on behalf of the very many arms that you poked a needle into, we thank you. And on behalf personally of myself and my family, who you helped inoculate, we thank you as well for making as much effort as possible, and for pulling out all stops to ensure that anyone who wanted a vaccination got a vaccination. And there was so much work behind the scenes that nobody will ever know about, but the people whom you help know, and we don't forget. So thank you for that.
No, I think that, it was a duty, and I think everyone, on this show worked very, very hard, but also we have, it was a good mechanism in place, a good system, and it's easy to be critical until you've seen other systems not work as well as yours. Then you realize, my goodness, Malaysia really has a good story to tell. And just to share with everyone, because I felt so strongly that the vaccination program, for me, was a signal of hope. So we've commissioned a very talented photographer to document some photographs. And I think I want to collaborate with Prof. Yvonne of as well, because she's been great, helping us get to Orang Asli communities and so forth. We want to have, in future, a series of, photo exhibitions, maybe virtual, maybe we might even use Sense with Science and show photos and tell stories about what was behind each photograph. I think it will be fun, but also to say that, it's a very sad pandemic. Every one of us has lost someone within 6 degrees of separation, but at the same time, we have to look forward, and we must have hope for the future, because it's taken a lot of a great toll on everyone, and on mental health as well.
That's so true. One question: now that we have reached 90% of our adult population having been vaccinated, with news that PWTC will be closing down as a mass vaccination center, what is going to be the next step? Where do the outliers, the ones who have not gotten vaccinated, either by choice or by design, where do they go to when they need to be vaccinated now?
think that WTC has closed. Most of the major PPVs have closed except for a few. I think there was some announcements by the Ministry of Health that there will be GP clinics in each state that will administer the vaccines for those who may have been left out, or some people who had COVID, right, and didn't have time to get the vaccine. So it doesn't mean that if you had COVID, you don't get yourself vaccinated. You need to get a vaccine as well. So the government hospitals, I don't know if the university hospital will also be, I think, part of the vaccine program as well. I think you can get it there.
Yeah.
Certainly those who come into the hospital, those who are warded, they have access as well. For pregnant women, for example, those who come to antenatal clinics, those who are admitted or those who have given birth, some women have opted not to take the vaccine when they were pregnant. So once they've given birth, maybe they can take it. So I think there are many options. And for those who were taking AstraZeneca, WTC has kept a information counter open where you can go and find out whether, say if you miss your second dose or something, where you can get it. And of course, our country has now started vaccinating the ones 12 to 17, and soon will be embarking on booster shots, particularly for immunocompromised and also the ones above 60, those with comorbidities. So I think that, there will be a lot of opportunity to get that. And we're not short of vaccines anymore. This is the good news that, the later it is in the year, the supplies come. And therefore we have, enough to cover everyone.
All right. So may I ask a little bit more about vaccinations for 13s and ups, right? Again, there are parents like me, we have mixed feelings about it. We want to have that responsibility to our community and the protection for our children, but we are readers as well, and we read things about, scarring of the heart tissues, in boys under the age of 12, under the age of 16 who have received a certain kind of vaccine. And there's always this doubt, can I count on the two doctors to clear this up a little bit and talk a little bit about vaccination for kids above 13?
I don't know, Adiba, whether you want to take that on and I supplement, or you want me to start?
You can start, yeah.
Yeah, I think, Karen, with the whole vaccination for COVID-19 has been, a lot of conspiracy theories have floated. People are saying this is a new vaccine, it's untested, which is not true. All the platforms that the vaccine has been using are not new platforms. The only newer one is the mRNA, but that's not completely new. It was being built for other vaccines. And when the pandemic happened, they shifted their attention to COVID-19. And this has been game changers. The other thing, of course, is that, one of the real, I would say, transformations in how we manage the pandemic has been the sheer degree of collaboration among scientists to not just look at vaccine development, but also treatments and so on and so forth. So science has led the way, right? And everything that we do, even on this show, is about evidence-based. So the vaccines have provided evidence for how and why they're effective, what are the side effects, and so on and so forth. Now, with younger people, there have been trials for all the vaccines, right? Whether it is Pfizer, mainly Pfizer, Sinovac even have done trials for children and so forth. And what it has found is that it is safe for a certain age group. Some, as you know, in the US, FDA has even approved it for younger people. Now, the whole issue around myocarditis, inflammation of the heart, pericarditis, it's the number of cases, number one, is not very high, but the secondly is more predominant in male compared to female. And part of the reasoning is that one of the advice that's very important after receiving any vaccine is you should rest. You shouldn't be trying to run the marathon or do spin cycling like Maisara. or or rock climbing, you've got to really kind of don't show your macho-ness and fitness after a vaccine program, because just like the flu, if you have a flu and you try to do your aerobics and stuff, you also run the risk of myocarditis. So I think if you take these precautions and you observe, then it is safe. I mean, it wouldn't have been approved if it wasn't safe. So over to you, Adiba.
Yeah, I would agree with all of that. And overall, it is transient, the myocarditis and pericarditis, but of course you don't wish to have that as a side effect. And this is one thing that actually the incidence decreases with age. So, age is a protection. It's more common with some the mRNA vaccines than the others. So the best advice is to, as Tan Sri said, not to exert yourself after your second dose. And the surveillance with the booster doses in the US thus far is showing that there is no increase of any side effects with the third dose. There's worry that as you enhance the immune system even more with the booster doses, that you're going to see more of these side effects. But thus far, with the rollout of the third or booster doses, there doesn't seem to be any increase of side effects occurring.
So where are the kids going to get vaccinated? Do either of you know? Because, there are very, very many school children who are suddenly now being rostered for vaccination. Particularly because my child is in the public school system, the schools have actually sent out circulars to the parents saying, could you please hold off on individual private vaccinations for your children, because the Ministry of Health wants to curate this by themselves, and they want to make sure that vaccinations are given in a systematic manner to all schools, but with a certain schedule. So, but they haven't told us what the plan is going to be, what kind of rollout, what kind of time, who gets it first. Is it is it youngest to oldest, oldest to youngest? Is there any insight on this from either one of you, please?
Not me, because I'm a bit more distant from the vaccine program, but Tan Sri Ji may know.
Yeah, I can answer that. Well, first of all, you're right. The Ministry of Education wants to, participate actively and sort of curate the vaccine program. So the priority ones were the exam going years, right? The 17, 16-year-olds going for SPM, STPM. And then state by state, they're doing the children. So for those who have completed, majority of the adults, they already started this and they're going school by school. The vaccination centers are walk-in now, right? So you can go in and get a walk-in. And those particularly are for those children who may not be in regular school. They may be homeschooled, or they're not in school as well, or children who may have dropped out of school, and within that age group. My advice would be pressure your school, ask them to keep checking with the Ministry of Health, because there shouldn't be a delay because the vaccines are available. Secondly, if your child happens to have some kind of medical condition that puts her or him at greater risk, or is in a household with older people who are at risk, if COVID is brought home, then I think there can be exceptions made to walk into some of the centers with the parents and explain that and get the vaccination. But the schools are supposed to be, especially the sekolah kerajaan and the public schools, are meant to do that. Now, I really hope those who may be watching the show, who may be working with marginalized communities, will also get their children vaccinated, particularly refugees, migrants, because there are NGOs like Mercy Malaysia. There's also Malaysian Red Crescent, Imaret, and others who are running vaccination programs as well for some of these more exposed and vulnerable groups.
Dr. Jim, do you think there is a possibility that the vaccination drive would mirror the kind of vaccination drives that the Ministry of Health and Ministry of Education has always had for our school-going children? Like the kids always get their mumps, measles, rubella, their boosters, and then the girls get their German measles and the vaccines that they are supposed to get at the age-appropriate time. Would it be possible for that same kind of system to be implemented? Like, a medical team goes to a school, using the daerah, the kesihatan daerah teams, to inoculate the kids school by school, as opposed to assigning children to different vaccination centers.
Yeah, I think so. I think that, first of all, the school immunization program of the Ministry of Health is a very well developed one. I think it's a good school immunization program. If this COVID-19 is truly endemic and persists for a long time, because let's hope that the virus actually mutates into a less virulent one and it fizzles out, just like SARS and others, right? So, I'm not a virologist, but I do know that viruses can also downgrade their virulence. So maybe we don't even need a vaccine, annual vaccine in the future. I think that might really happen. So in the meantime, that could. And also it gives us opportunity now to introduce other vaccine programs, right, into our adult vaccination program. We don't have an adult vaccination program. That's why, countries like the UK it was so easy for them to vaccinate, because every year, if you're an adult, you go and get your flu shot. You walk into Boots or whatever and get your shot. So, this is now a way that we can get adults to get adult vaccination program. I would be very keen to see, that Gardasil or the HPV vaccine is given to women and girls, right? Because we know that cervical cancer is preventable. So I think, I think we should do one show on women cancer in future.
That's really part of the program, I think. The HPV vaccine.
In school children, in adolescent, but I think it should be extended to adult vaccination programs, right? For those who have missed the school kind of vaccination programs. I think this is something very useful as well.
All right. So moving forward, we know that restrictions have really loosened. We are dining out. We're seeing friends again. Some of us even dare to hug. But masking, hand washing, social distancing is still our first line of defense against COVID, right? Will this be changing anytime soon, Professor Adiba?
I think we need to remain vigilant and we need to do all these things. It's just good practice anyway. A lot of people don't like wearing masks, but until we see a real leveling of infection, we have a very low level of infection. It really is not that difficult to have the mask on in crowded places and in buildings. I certainly would prefer to have a mask on rather than, be in hospital or having to quarantine just because, it's too disruptive just because you've been careless, right? So hand washing protects you from not just SARS-CoV-2, but other, sort of bacterial and viruses. So these are just good practices to continue to live with. So why not? And TB is still endemic in Malaysia, spreads in the same manner. So yeah.
Okay. So
and I agree with Tan Sri James in terms of not just focusing on vaccine, which is adult vaccination, which is really important. I think how many of us make annual flu vaccination as a routine, but also for the healthcare system to really pivot and invest in preventive. It's not just about vaccination, but also all the evidence-based screening. How many of us have had HPV DNA screen or pap smear? How many people have, over the age of 50, have had a colorectal cancer screen? So, there are many of these good preventative medicine that I think we all should now embrace, and not just wait for the next pandemic, but pivot towards taking care of ourselves better.
For many people, there's still that latent fear of, surface contact, and there is still a huge market where some friends of mine continue to leave groceries out, spray everything down, Can you just talk a little bit about the prudent use of sanitizers on shopping bags and aerosol disinfectants in closed spaces?
There is none. SARS-CoV. I have to take a deep breath before I say this.
I was going to say this spraying business is Adiba's forte.
SARS-CoV-2 is airborne, it's droplet, it remains in the air. Where you should be paying attention to is when you're indoors and, and in crowded places that's poorly ventilated. It doesn't live for very long on, surfaces. You focusing your friends, focusing their attention on the wrong things. By all means, wash your vegetables and wash your fruits just like you would, anyway. But no, it doesn't spread that way.
Yeah. So go easy on the Lysol.
And we've got to stop. Yeah. And we've got to stop this nonsense of, wearing gloves when you go into a boutique or, supermarket, because, how much plastic are we wasting?
Yes, that's the other thing.
This really fires me up because, my planetary health interests, right? But I think this is something, Adiba, we both need to keep pushing. That we've got to change all these nonsensical practices. I went to do a home vaccination the other day, and the family insisted on spraying me. I said, "No, you're not spraying me. This doesn't make sense. Number one, and number two, I might be allergic to whatever you're spraying me with. And here I am trying to help to vaccinate your mom. But anyway, we've got to keep educating people that you have to use evidence and science. This is exactly why we have this show, right? I laugh so hard when you talk about spraying, because Adiba has been in the spraying controversy. That's one thing that we will take away from this whole experience. How even when you use science, people will just will not see reason, right? And I think both of us have been at the end of of many critical sort of criticisms and so forth because of our views, and but we persist because we owe it to the public to tell the truth and to push for what we think is evidence-based.
Agreed. Absolutely agree. I'm so glad to hear this from you all, because I'm getting very, very tired of being sprayed down with Lysol and Melaleuca when I enter a certain friend's house. It's like, oh, here, you're a bug, take that before you enter my home. But yes, okay, moving along. Doctors, let's talk about immunity depth. We are so clean. Are we going to get sicker because we've been so clean?
I think there is, the concern right now in countries that have not about being clean, but in countries that were pursuing zero COVID, that there are concerns now that Delta is coming in and the vaccination coverage hasn't gone up adequately, that because the large proportion of their I think we have a cameo appearance, so I'll quickly wrap this up. Large proportion of their population are sort of COVID naive or SARS-CoV-2 naive, that there are concerns that they may have a bad situation on their hands.
All right.
I can see that
Okay.
Karen can barely hold her excitement with our cameo appearance.
I cannot, oh no, I can believe it, because as far as Dr. Jamila and Professor Adiba making things happen, these are women who make it happen. But ladies and gentlemen, and the entire of Facebook and our live stream, welcome Yang Berhormat Khairy Jamaluddin, our new Minister of Health, to Sense with Science.
Thank you, Karen. Thank you, Tan Sri and Professor. I'm in my car at the moment. I just left an event with the Malaysian Medical Association, so I thought I'd sign in before I lose the session with you guys.
Thank you so much.
Thanks for joining us.
Yeah, I must say, Karen, that we are so fortunate to have YB, as our Minister of Health. And just for your information, Yang Muhammad, we just started this little discussion about why we should stop spraying people and wearing gloves in supermarkets and boutiques, and how plastic is harming our environment. So we're hoping that, in your new role, it's not so new anymore, you're a seasoned Minister of Health now, but the SOPs will be very much more science-based, and this is exactly what we're doing to support you as well. So really, really happy to see you, and thank you for dropping in.
No, thank you, Tan Sri. I think, I think you're absolutely right. We need to streamline a lot of the SOPs. I think we need to simplify things so that it's easier for people to understand and explain to them why the SOPs matter in terms of science. And you're right. I had an awkward moment just now at the MMA, and they asked me to cut a ribbon where the ribbon held this banner with balloons, pink balloons, blue balloons, and green balloons. Green balloons for Mental Health Day today, blue balloons for Malaysian Doctors Day, and pink for Breast Cancer Month. And of course, balloons, I don't like balloons because they pollute the oceans. So, we have to have a new way of looking at what you're doing now, planetary health, right? Everything affects everything else. I was telling people about mental health today, that affects your physical health affects your mental health. And I think one key takeaway from COVID and exiting, hopefully in the next year or so, is that we understand better that a lot of things, they're multi-dimensional causes for health problems and also for healthcare.
That's music.
Question.
Oh, yes. Yeah.
First, I think on behalf of the community on Facebook, the Sense with Science community, congratulations on the appointment. All the people who have some sense with science have lauded your appointment, and we're very glad to have a very vocal and a very well-spoken personage for Ministry on top of the Ministry of Health. So thank you for that. I know you've had a baptism by fire, but congratulations on riding the wave and bringing us to where we are now. Of course, DJ Hisham has been fantastic, an ally in all the things that we've achieved. But your few months in office have been prolific, to say the least. And congratulations. And I'm wondering, since we can now cross state borders, are you going to be taking any kind of break?
I've told my family that I can't take a holiday anytime soon. I think even if I could, I wouldn't be able to relax properly. I think the next few weeks are very, very critical to ensure that there's no surge of cases. My biggest worry is not so much the top line figures of the number of cases, but of course the public healthcare capacity. That's something that keeps me awake at night, because If the numbers translate to greater or increased hospital admissions as well as ICU admissions, then we're back to square one. So I think as we learn to live with COVID-19 and become a COVID resilient nation, we have to play our role together in ensuring that we don't overwhelm the public healthcare system. I think what I caught the tail end of what Professor Adiba was saying just now is that it's important for us to be vaccinated as well as to allow for people to also enjoy their freedoms, because inevitably most people will come into contact with SARS-CoV-2 once we open up. And for a vast majority of people, what we want that to be would be to either be asymptomatic or very, very mild or light symptoms. Building that natural immunity is also very important, but we don't want it to be at a high cost of deaths and hospitalization, because we also have to be aware of long COVID and what we don't know about long COVID. People end up having symptoms and also having medical conditions long after they are infected with COVID. But I think what we announced today is carefully calibrated. It's gradual and it's towards reopening safely. And I hope that that self-awareness and the self-discipline will really come into play as far as the Malaysian public is concerned.
Right, that was a fine executive summary. I think it's one of these, say my piece and get out. I've done my duty, and I've appeased the good doctors, and I've kept on everyone's good sides. Yeah, YB, is there anything that you want to say about the importance of psychosocial support in this prolonged time of lockdown?
Yeah, so I think it was fortuitous, and I mean, it was obviously coincidental that the announcement by the Prime Minister was made today on World Mental Health Day, because I think apart from any announcement that I can make as Health Minister, I think the allowing people to cross state lines actually alleviates a lot of the mental health problems that people are facing. You know, we've been locked down. Human beings are social animals. We need to see people. We need to have that close contact with our family. We have to go back to our kampongs, and we have to travel. And I think that goes a long way in, as I said, alleviating the mental health pressures that people are faced with. But I think going beyond that, I did say a few things today about mental health and psychosocial support. We need to make it more accessible for people. I think that's a huge gap, which I admit is still there. We have facilities, but it's not enough. We have specialists, but again, not enough. We need to invest more in mental health. We need to leverage on digital technology, which can also assist with delivering care for mental health. And there's so much out there that we can curate, that we can develop, that we can just take off the shelf and use that as part of our care for mental health. And the other thing that I announced today is I want to relook and revise and revisit setting up a center for excellence for mental health. If not a physical center, but at least repurposing some of the existing centers so that it's not just for research, but it's the top-class referral center for mental health in Malaysia. And I hope I can make that happen while I'm at the Ministry of Health.
YB,
I mean, they're really great plans forward. But I think one of the other important things in terms of mental health is the huge stigma that comes with it, that prevents people from coming forward, seeking help. Just a mere thought of, whenever we non-psychiatrists say we want to refer you to a psychiatrist, patients have this internal stigma, and of course people around them also have stigma. So there are many angles I think that we need to continue to work on, but those things that you've just highlighted, YB, are all great efforts, of course. Yeah.
I may want to add as well. I'd love to add to thank you and the ministry for decriminalizing suicide. I think that move is so critical and so important. And also, YB, just to share with you that in my previous work at IFRC, we have a global center for psychosocial global center. So there are a lot of tools already there that I can help to make available to the Ministry of Health, because there's already a global center of excellence that we can look at what they've done and how is that relevant also to Malaysia. So these are fantastic moves. But I wanted to share with you two things that was discussed earlier before you appeared. And one is how this pandemic has offered us a window to look into adult vaccination programs, and how, we are not like the UK that has the regular flu shots and so forth, and how we focus to preventive medicine. And, for example, for young women, young girls and women to have their shots for cervical cancer prevention and so on and so forth. I think this is all part of the health reform that I hope that you will steer forward, Yang Berhormat. But you can count on your two ladies, medical people here, who are constantly badgering you on WhatsApp. But we want to see you really bring to life all the things we only can dream about happening for Malaysia. So really, thank you so much for everything.
Yeah, no, thank you. Maybe before I have to sign off, I just wanted to say on mental health, there's another thing which I didn't have the chance to say earlier during my event for mental health before I was at MMA. And this is a support that we need to give to people who care for family members who have mental health issues. Research has shown that if they are supported, if they're trained properly, then the outcome for their family members who have mental health will be much, much better. And it's not just mental health, which is popularly understood now, those who have depression, those who have anxiety, PTSD. This includes a whole plethora of other things. Autism. My second son, as you know, has autism. Dementia. My father-in-law has dementia. And it's so difficult seeing not just his deterioration, but also having to see my mother-in-law having to, care for him and her mental health as well. So I think these are things that people often overlook. But coming back to Tan Sri's point at the end is I think reimagining healthcare, big agenda. I mean, one good thing about, we haven't exited COVID, we're not even out of the woods, but at least with the cases coming down, is that we can spend our time and effort on other non-COVID things as well. And that's really important to reimagine the future of healthcare. And I am not bothered that my two, aunties bother me on a daily basis.
Kakak, please.
Okay, kakak.
I am auntie.
I'm more than happy to be nagged.
But I'm really, thank you for sharing your personal experience and hardship, but it's not always easy to open up as such. But your pivot towards preventive care and community-based care, that's a whole area of work that in the long run, I think would improve care and be less costly. So that's my thing with my NGO hat. I think that's really, really important.
Both of us,
professionalize our civil society, community-based care, and have proper training and accreditation, funding, etc., etc. Much work to be done, but yes, we need to sort out the national testing strategy first.
That's tomorrow. Thank you. I don't know if you can hear me, but thank you. I've got to dash off. Thank you, everyone.
All right.
For listening.
Thank you,
Thank
YB.
you, Karen. Thank you, everyone.
Bye.
Bye. Thanks.
Bye-bye.
Bye. Thank you, YB.
Well,
I think, Karen, I could see you reacting. The personal experience of caring for someone with a deteriorating neurological state, right? And the mental health pressure it exerts on carers. So, here we have a health minister who knows what he's doing. It's really refreshing. So, I don't know about you, Adiba, but, every time we send a message to YB, there's always a response. And, and really also willing to question our judgment as well, which is what I like, right? No, don't just take what we say as the absolute truth. Question us because we all are not perfect, and that we're all in quest for.
We don't know everything.
Mm-hmm. Absolutely.
Yeah, but you are led by empirical evidence. You are led by science-based research. Not knowing everything is not an excuse not to share what you know. And I think this is why the program has been so important to so many people, that we've been a conduit of good sense to a lot of people. And speaking of that, vaccine hesitancy has decreased quite a bit among Malaysians, partly by the campaigns run by the Minister of Health, partly with programs such as the ones we do. Now, what's going to happen to those outliers? What's going to happen to those anti-vaxxers? Those people who still consistently deny the the presence of COVID-19 in our midst. Those people who say that natural antibodies will win against a vaccination. What is your take on this?
Yeah, if I can go first here, I think the vaccine mandate is very much welcome, especially for people who are working with others who, because whilst a vaccine, its main job is to protect everyone from getting severe disease and, dying from it and overwhelming the health system, etc. And it does a great job of that. It also does reduce, you transmitting the virus to others who may, for whatever reason, not, for legitimate reasons, not be able to be vaccinated or not able to mount a good enough immune response because you're immunocompromised, or in young children, they may not, the majority may not get severe disease like adults, but, we still don't know if they're going to develop long-term complications later on or long COVID. So there have been many analogies to the COVID vaccination as in wearing a seatbelt. You're not only protecting yourself, but or drunk driving, for instance. Why there needs to be a law against drunk driving, because you're going to harm other people, not just yourself. So I'm being very militant here, and I welcome the vaccine mandate that the government has put in for civil servants, and I hope the private sector does the same. The costs that we have been through in lives, in dollars, in mental health, in everything over the last 2 years, and here we have a solution, and to have people to deny it, to say no to it is just infuriating, right? There are all these reports, like fortunately in Malaysia, the number of people who are refusing vaccine is relatively small, but you read these stories from the US, for instance, that compassion fatigue by healthcare workers like me have just gone because they're seeing so many new cases in ICU of unvaccinated people in some sections of the US. Some of my nurses have been, quite militant as well when we get patients with severe disease, and tell them off. But whatever it is, we will care for them. We still have to care for them, but it's so unnecessary, right? That illness is so unnecessary, and it's one thing, like I say, it's one thing to put yourself at risk, but you're also putting other people around you at risk. So that's the annoying thing about the anti-vaxxers. And mind you, it's not always just people who have less access to information or less knowledge. Sometimes the smarter they are, the more sort of they dig into the anti-vaxxness, and practice pseudoscience.
I must concur with Adiba, and also to remind everyone that there will be a small group of people who can't be vaccinated, those who have anaphylaxis, those who are severely immunocompromised, and so forth. And the mandate is a tricky one, but I think that it was the right decision to make, because we always say no one is safe till everyone is safe. But I want to remind, as a Muslim myself, let me remind Muslim viewers, there is something called Maqasid Sharia, and it is the basic tenets of one of the basic tenets of how we live as Muslims, and that is that we have a responsibility to humanity. And that means we have a responsibility to each other. We have a responsibility to the environment, to animals, and I think that that responsibility includes us protecting others and ourselves from contracting a disease that is actually, the severity of which is actually preventable. So we have a vaccine that works. I think I also want to reiterate something Adiba said, which is very important. And she said that, when you're vaccinated, your transmission risk is lower than if you're not vaccinated, because there have been recent studies, and this is what the anti-vax groups have been using to say that, what's the point of being vaccinated? You still transmit. But they have found that the viral load is much lower in those who are vaccinated, and also the duration of risk of transmission is also lower. So if you are masked, if you take other public health measures, obviously your risk will become very much reduced. So don't twist the science as well, right? Don't use the evidence and twist it to your your own liking. Again, speaking from the perspective of someone sitting in Europe right now, we found that, what I'm seeing is that there are very strong groups who are anti-vax and who don't want to be involved with this. And that, the government is really struggling to figure out what to do with them. So I think one of the ways that at least the French government has done is that they have made the COVID passport something that is mandatory. So the disincentives of not being vaccinated, not being able to eat in restaurants, dine in, go into concerts. In UK, for example, if you want to, also I'm planning to go to the UK next week for some work, and I thought, why don't I take my grandnieces to watch Frozen on West End? God help me if I go, because I really can't stand the songs. But and then I discovered that to watch a play in the West End, you need to have a PCR before you go into theatre. So that kind of was the, thank God I don't have to go now, but, but that's how strict they are. So I think let's be, let's not be sympathetic towards anti-vax. I think that, I certainly have no sympathy or empathy towards them. I'd rather be more empathetic for our healthcare workers who are constantly at risk. And we owe it to each other to protect each other.
I absolutely concur with that. Yes, there will be segments of the public, a very, very small segment, who cannot be vaccinated for health reasons. And for those, we shouldn't discriminate against. We vaccinate ourselves so that we can help those who cannot be vaccinated to be protected. We do it for the community, we do it for us. But for people who blatantly just think that it is their right not to vaccinate, those are the people that we have issues with, definitely. We have a question from Facebook of all the things that we spoke about, and this is the question. Basically, when we talked about spraying things down with aerosol disinfectants, and how Professor Adiba has said that, it really is not necessary, it is counterproductive, it is sometimes it's not good for your health. But this person wants to know, Professor Adiba, what about spraying down the lift before you enter it? Same thing?
The most important thing is getting vaccinated plus wearing a mask properly. So, because some of the sprays may not be totally harmless, right? And yeah, so that's my answer to that. And how long are we going to live our lives, spraying everything around us? So vaccine plus masks should be more than enough to protect you.
Okay, as we are moving back into more normalized life, people are going back into work, working longer hours, more days, a more set schedule into the workplace. Ventilation is key in those workplaces. Unfortunately, not all offices have great ventilation. Indoor air circulation is bad because buildings are enclosed. Professor Adiba, this is your particular soapbox, so tell us about taking care of yourself when you go back to work in office building, in whose environments you can't necessarily control.
One thing I'm really pleased about is that a lot more people are talking about this, right, Nasri Jim? There are actually organizations of engineers, of builders, of architects who are really looking at this quite seriously. There's an organization called ASHRAE. Just last Friday, I think they had a webinar. I've been asked to speak at a sort of group of developers and things like that. So, these things are long-term measures. Of course, short-term measures that we can take, like opening windows and placing fans in the right place, must be done ASAP. But long-term, and this is where Tan Sri Jamila's new planetary center comes in too. If we can go back to how we used to live, with houses that were designed to take in the airflow and ventilate, and with open windows instead of air conditioning. I know that the climate is getting hotter, but I'm sure there are things that can be done. My house has windows and doors open nearly 24/7. Of course, there are issues around security, etc., but these are long-term things. So moving forward, I think COVID-19 has, of course, brought us to our knees, devastated us in many, many ways, but it's also time for us to reflect and, not just manage it from a health perspective, but the entire ecosystem, starting from education to the environment to economics, because all these things are connected. And if we don't do that, then it would have been a wasted 2 years, in my opinion.
I really love what you said. Yeah, that's
and thank you so much, Adiba, for acknowledging the importance of planetary health. I'm so pleased to tell you that everything is, the dots are connecting, right? Because at COP26 next month, I've just been invited to speak on a panel on health and climate, and I think that you look at the amount of, again, plastic disposable masks that we've been using. They will end in the oceans. When I was climbing up a little mountain here, I saw 2 disposable masks, only 2, thank God, that had been lodged on a rock. So it may have flown off somebody's pocket or something. But the fact is that these things will end up somewhere. All the stuff that we're using, these chemicals that we're spraying will also affect the insects around us and other things. So I think we've really, got to go back to understanding why we got here in the first place. We got here because we as human beings have damaged our environment. We have overdeveloped, the zoonotic leak from animals to humans has happened. And this is why I'm really passionate about what I do now in planetary health. It's not just about managing a pandemic, but preventing the next one. And I think, Adiba will know this even better than me, that in the infectious disease world, people are already planning and looking ahead in terms of disease X. When is the next pandemic going to happen? It's not going to be 100-year intervals anymore. We're going to get little more outbreaks here and there. And so it is on us. It's not on the government. It's not on the Ministry of Health. It's not on the doctors who are working hard in the hospitals. It's us. We have to change the way we behave. We have to change the way we consume. So I think that, if anything, maybe the next set of, sessions we have might touch on planetary health and the sense with the science of planetary health. But, for now, I think, COVID-19 has been a wake-up call. COVID-19 has been a dress rehearsal. And, we don't want to be pessimists. We have to be optimistic about the future, because you know what? The future is actually within our control. We have to change the way we behave so that we have a better future for ourselves and for generations to come.
Well said. Thank you so much, Dr. Jim. I think as we wrap up the show today, as well as the series on the whole, let's talk a little bit about the positive changes that COVID has wrought. You know, we talked so much about the losses, we talked so much about the toll on mental health, we talked so much about the environmental pollution that has resulted from the use of PPE, face masks, and the like. Let's talk a little bit more, let's talk a bit more positively about good changes that COVID has brought about.
I think for me, it's you know, the health, at least in my hospital, that we all came together. You know, it wasn't just the infection problem for infectious diseases doctors. One day when I walked into the hospital and I had the orthopedic surgeons, the obstetrics and gynecology, everyone pulling their weight to look after patients. And so that was, you know, they all grumbled, but they still, you know, did their best. And I think part of that grumbling was also the insecurity and the fear of, you know, going into something completely new. But that was really, really nice to see that everyone pulled their weight and helped one another. That's number one. Number two, you know, we in the health fraternity are really, really slow at adopting, whether it's scientific innovations or, you know, research or whatever. I mean, look at the bankers, look at the financial sector. They adopted digitization, 15 years ago, right? When was the last time you had to physically walk into a bank? Whereas we've now just got COVID and we go, oh, we must do telemedicine. We must, you know, digitize. We must do that. Well, hell, it's been there all the time. It's just that we're either too busy, we don't have enough, you know, we're not as flush with funds as the bankers to innovate and to, you know, digitize ourselves. So I think that's the important thing that COVID has shown us, that, you know, it's no longer a nice thing to have. It's imperative that we digitize from, you know, simple things like electronic medical records, all the way to, if you want to be super, super changi, you know, all the AIs that are now coming into medicine. Yeah, and to really reassess how we do things, how to be more efficient, how to be patient-centered. I mean, one of the things that was very difficult for my colleagues in intensive care, for instance, you know, because of that that need to isolate patients and not allow relatives to come in. How do we continue to humanize our care when, you know, you've got all these barriers? So hopefully it's also been a time for all of us to reflect. I'm addressing the health fraternity here, but in general.
Dr. Jamila, how about you? What were you proud about? What were you happy about with what COVID made us sit still and reflect?
Well, I think all the things that Adiba mentioned are critical. You know, Adiba and I have been part of this health reform journey from 2 ministers ago. And, you know, I'm really, you know, hopeful that we will be able to make some progress. I think, if anything, this pandemic offered us an opportunity to really re-examine our values. What is it that, you know, what is important to us? As we return to normalcy, do we lose some of these values we suddenly have come to realize are more important than the next, you know, Prada handbag, or, you know, the next travel overseas, whatever, right? It was, if at the end of the day, it was about good health. It's about loved ones being safe. And I think that, you know, collegiality, collaboration, camaraderie, all these things that actually helped us through this pandemic. It has been a horrific 1.5 years, right? It's been painful, but as I mentioned, you know, I try to see the light and the uplifting moments in every, you know, every moment of darkness that we have. The people who have really made a difference to our lives. and to the lives of others. So let's keep that constantly, within us, in our minds as we come out of this eventually, that remember what it was like when you didn't have that freedom, when you didn't have that choice to go out or to travel or whatever. What was important to you then? And let's also think about future generations, how we are all having to remain good ancestors for them.
Right. If there was one thing I was proud of this year, or in fact the 2 years that we were in pandemic lockdown, it was being part of Sense of Science with you both. If there was any hope to cling to during those sometimes very dark times, it was Dr. Jim reminding me again and again to trust the science. So as we wrap up, what were your favorite moments of the show?
Oh gosh, there were so many. I think what Tan Sri Jim touched on in terms of the vaccination for pregnancy. I think that was, if I may say so, quite a game changer, because there was a lot of confusion around that time whether vaccination is safe for women, vaccination, there was a lot of hesitancy amongst pregnant women. And after that, I think Imelda, in her inimitable style, managed to convince, and she personally had lots and lots of calls and patients reaching out, or ladies reaching out to her. And of course, the ventilation issue with both Sashila and Serena, who, but every episode had its moment.
Yeah. I think so. Every episode had their own special, feature about them. I really felt when we kicked off, remember we had Zai, who gave a real life experience of having gone through COVID. That to me was the game changer for us when we started to bring guests on board. And having Zai give that raw emotion of the fear that she had. And, one thing that was not seen as she was speaking to us on the screen, her daughter, who also had COVID, remember that 5 members of her family had COVID. Her daughter was sitting on the floor holding her hand while she spoke to us, because it was so emotional for them. And, it is really my hope, when we started talking, it was really a chat between me and Adiba on WhatsApp as usual, saying that we need to have this, demystifying and I said, well, let's do it as a show and get a good.
It started off with your daughter, right? It was Chinese New Year.
Yes, it was Chinese New Year too. That was another special
Chinese New Year.
Yeah, and then her friend, right? Gosh, every session was really exciting and great. And let's not make this the last. I'm sure we can convene from time to time. Certainly now there's interest in talking about planetary health. And one thing I must say, and this is not meant to be discriminatory, but the only man we've had on the show was YB KJ as a cameo appearance. And if anything, I think all of us in this show are real gender champions, that, women are also scientists and women also have knowledge and capacity. And you know what? We weren't short of women to call. And that was really, very good and exciting as well.
So before we sign off for the final time, where is Sense with Science going to go after this, Dr. Jamala? That's been the question.
What's
well, let's see.
Okay.
Karen said, where's it going after this?
Oh, okay.
Is that right, Karen?
Yep, I did. That's on behalf of all our fans on Facebook and all the people who come to depend on our Sunday, tea sessions with the two fine women of science.
Yeah, I'd love to have Adiba and, we invite Professor is it Wu on your project Rose?
Yeah.
To talk about, preventing women cancers, gynecological cancers. I think it'd be fantastic to have that. I'm not biased just because I'm a OBGYN.
I would this once a month, maybe once a week. Yeah, it's
not much. Maybe once a month. Once a month.
My mental health.
I think once a month is good. And then, let's do one on planetary health, because I think I need to introduce this subject to everyone. Let's also, maybe hear from
heaps, mental health, planetary health. If you want to keep it to science and health.
Yeah. But always with evidence.
Endless. Yeah.
All right. So
that'd be great.
Definitely.
Oh, I have to speak to the sponsor.
We can talk about, what we touched about autism. We can talk the latest about, management of autism. We can talk about Alzheimer's.
Yeah.
Oh gosh, the list can go on and on.
Yeah, I think it'll be fantastic. I know that YB's wife is a great champion in the autism space, spectrum space. I think, Alzheimer's, dementia is very, very important. So I think we've committed now that at least once a month we will try and do something. And I will now have to go and rattle the sponsor to see whether they can continue to support us.
Maybe we can start with we had two ladies come talk about COVID in the elderly, right?
That's
because my colleagues in the geriatric department I did send to you. It's going to be World Older People's Day soon.
Yes.
Soon, like in a few weeks. So we can kick off with that if you like. I'll drag them to. Pretty good at volunteering people. What's it called? Yeah. World Older People's International Day of Older Persons, 1st of October. There you go. We're a bit behind, but never mind.
Yeah, I mean, we can always choose a lot of topics.
Yeah, so many topics.
Talking about older people, I now qualify for discount in the UK on on public transport, but I don't
you
feel.
Also get free coffee, Dr. Jim, at Marks and Spencer's.
Yes. So there are some benefits of getting old. I just got called auntie by a minister, so. So I think there's lots to discuss. But again, thank you, Adiba. Thank you, Karen. Thank you, Sarah, Kadi, Amanda. Thank you to all our viewers. And I can't imagine. I've shared with some of you the lovely messages I've been getting from people. And some of them even attempt to meet us. So it's wonderful. And I hope that this will be something we can continue in a different form or less frequent form. But you guys have been amazing, and it's been a true honor and privilege to be working on this, and we continue to do so. This is not the end.
And well said. So we end the not so final episode of Sense with Science, and while our viewers will have gotten to know and appreciate the wisdom of our series progenitor and co-host, I do need to say a huge and heartfelt thank you to the women behind the scenes. Dr. Jim has already lauded them before we started the show, but to Amanda Mojadif and Sabah for analyzing our shows and suggesting tweaks, to Kadi Zainal for her TikToks and poster designs and social media management, and my Sarah for holding it all together behind the scenes. You guys, you ladies have been amazing and so life-giving, and we are so thankful for it. Any last words before you sign off for now, Professor Adiba and Dr. Jim?
No, I think I've said enough, and thank you, Karen. You've been the one behind us, making sure that we stay on topic. And been wonderful. Thank you.
Thank you. It's been a pleasure. And so for the last time, this is Karen Michaela Tan signing off from Sense with Science. Stay safer in my Malaysia and stay kind. Goodbye for now from all of us. Thank you for watching and stay tuned. For
It's
more.
farewell. It's farewell. It's not goodbye.
It is farewell for now. Yes, we will meet again. And until next time, keep following us on Facebook. Thank you so much for your support. Bye,
And
Malaysia.
Karen, there are some questions on Facebook unanswered.
Okay.
I think we need to go into Facebook and answer some of them.
Yes, ma'am. We will do that. All right. So this is not the end.
Bye.
Continue. Bye.
Bye.
See you for